Happy Friday, Baylor College of Medicine and friends of Baylor. Lots to discuss this week, especially about Lily's 5-point plan for living with the virus. But first, let's see what's happening in the world. Italy, love Italy. They have the toughest control measures of any Western democracy. You have to have proof of vaccination, a negative rapid swab test, or recent recovery from COVID that's documented to get into any public or private event. So they're doing it the right way. Russia, not so much. They're up to about 1,000 deaths per day, and only a third of their country is vaccinated. I mentioned last week, no one trusts the Sputnik vaccine, but what are you going to do? One interesting phenomenon, deaths from tuberculosis have actually increased for the first time in decades, and it's almost 1.5 million deaths this year. Most people in the WHO think it's due to the fact that with COVID there's been a loss of a lot of the surveillance mechanisms, and so we're not picking up TB, but that's something to watch in the future. Australia, they've moved ahead of the United States in vaccines. They now have 72% of their population has been vaccinated with at least one dose, whereas the U.S. is about 66%. And another good thing, nearly half the world's population has been vaccinated. The problem is it's completely variable and very much dependent upon the wealth of the country. So there's huge disparities worldwide on vaccine access and availability. Interestingly enough, I've showed this graph before, Europe is actually worse than the United States. They're continuing to go up. And that's really being driven by the United Kingdom. The United Kingdom continues to be the worst performing democracy on earth. I mean, it's just amazing how badly they're doing. But again, they've sort of given up, they've capitulated, they've given up on public health. The recent map from the CDC, which shows high-risk areas. High-risk areas are in red, low-risk are in yellow and blue. And the interesting thing you can see is there's two ways to get into low risk. One is the states that just ignored it and let everybody get infected, Florida, Louisiana, Arkansas. They're now getting low risk because so many people have been infected. But Puerto Rico did it right. Look at Puerto Rico. Very good, low risk. And that's because they did all in on vaccination. So if you look at the vaccination status in the country, Puerto Rico is the only territory actually that had low risk because of vaccination. The other areas that are low risk are because there were low vaccinations and a lot of infections. That's not the way to do it because there was a lot of overwhelming the health system in Florida and Arkansas. And they, had high mortality. So that's not the right way to do it. The right way to do it is to be vaccinated. So what's happened in the United States? It's kind of what I have been concerned about all along. It's been falling down, but it is definitely plateauing. The rate of fall is getting less. I guess the good news is that 58% of the population has been completely vaccinated, but we're still having over 1,000 deaths per day on average as of last week. And we're running about 72,000 cases nationwide, which is just way too many. But as you start thinking about, I'm trying to be optimistic here, if you start thinking about as we approach herd immunity, things will get better. And just to do a rough calculation, 58% of the population that's been vaccinated, that's 185 million people, with 45 million already infected, and we've done that prevalence calculation. We think the real number is about 3 times that. And half of those people probably have been also vaccinated. So there's another 68 million who are resistant, probably because they got infected. And then now with the 23 million kids, 5 to 11, eligible for vaccination that the CDC approved this week, that, we figure about 60% or 70% get vaccinated. We're getting close almost to 267 or 270 million people who will be resistant. But within our number of 6 or 7, like this virus is, that it will take 90% of the population really resistant to see just the fall of this infection rate spontaneously. That's 288 million people. But we're getting there. We're getting very close to that, which is why I remain optimistic. But the fact that it's plateauing here is why the Institute for Health Metrics continues to suggest that we will be living with this virus for quite a long time, which is really unfortunate because we have the means to get rid of it if we just had more people vaccinated. So Texas is doing better. You can see its rates falling down, which is good. And of course, much of Texas remains high risk, but we're beginning to get moderate risk areas. Our friends in Dimmitt County, home of the javelina, remain a pretty high-risk area because they've continued to have infections. Although they've done a good job of vaccination, they just haven't reached the threshold yet. And our own Harris County is moved down to sort of orange or substantial infection rate, but we're not anywhere near moderate or low yet, which is really important. And in the Texas Medical Center, the case numbers beginning to fall. Last week, it was averaging 659 cases per day, and you can see it's falling, but it's not, the rate of fall is slowing, and it's looking like it's plateauing. And the same for hospitalizations. Last week, we averaged 86 hospitalizations per day, which is not low enough. I mean, it's just beginning to plateau, which again suggests that those projections are real, that we're going to be living with the virus for a long time. Because it's the beginning of flu season, I just want to remind everyone, the flu virus, remember, we showed this last week, it's an RNA virus, 8 strands of RNA. It has different proteins on its surface than COVID. It has two major proteins, the hemagglutinin protein and the neuraminidase. Those are important for the virus to get into the cells and then the virus to escape it. And we identify flu viruses based on those two proteins, H1 or N1 or H3N2. Those are the main influenza A viruses. And remember, I mentioned last week, there's two major types of influenza, A, and there's two major types of influenza B, the Victoria and Yamagata strains. And so when you get a quadrivalent vaccine, it's sort of one of each of the 4 major strains. And so what's going on with flu right now? So far, only 288 patients have been admitted to the hospitals with the diagnosis of influenza. Most of those have been influenza B, 60% of those, and of the Victoria type. The other 40% are influenza A of the H3N2 type. So nothing really unusual, but a pretty high expectation that we could see a big flu season. And if you look at the CDC follows what's called PIC, pneumonia, influenza, and COVID-19 mortality. Most of the mortality has been due to COVID. The yellow areas are influenza outbreaks, and you can see we just didn't have influenza last year. And it's really most dramatic in the pediatric population. This is pediatric deaths in 2019, 2020. Look at this, only one kid had died from influenza last year. So we're a little bit concerned that because everyone's susceptible, we might have a big influenza season this year. But let's get back to what my sister wanted to know, is how is this pandemic going to end? And of course, I've spent a lot of time trying to figure out how to explain it to my sister. So, and as you know, or you may remember, my sister's an English professor. So I think it's going to end the way T.S. Eliot predicted. Remember, T.S. Eliot is an American poet in the early 1900s, and he wrote a very famous poem in 1925 called The Hollow Men. And it was a really interesting time. It was after World War I. There had been a lot of deaths after World War I. It was just at a time before the stock market crashed. And what he was concerned about at the time was a lack of substance of leaders. And it was at all levels a lack of substance, spirituality, communication, lack of direction, lack of leadership. And he wrote that, the famous ending that everyone knows. That
life is, for thine is thee. This is the way the world ends, this is the way the world ends, this is the way the world ends, not with a bang but a whimper.
So when my sister asked, how will this pandemic end? It's going to end not with a bang, but a whimper. And what does that mean? Well, we had the opportunity to end this with a bang. We have the means, we've all developed the vaccines. If 90% of the population got vaccinated, we would end this epidemic in the United States with a bang. It would be over. Unfortunately, we didn't. So why the whimper? Well, think about T.S. Eliot. We have misinformation on the internet. We have a fairly substantial anti-vaccine movement. We have a lot of people who are giving misinformation about the science. We have people who believe in conspiracy theories. And so what would T.S. Eliot refer to those? Those would be the voices of the hollow men that really end up paralyzing us to do what's right. And so I think what will happen is this will recede slowly but surely, almost like a tide. The tide's going out. It'll slowly recede. It'll begin to transform as older people get vaccinated, more and more people get vaccinated or exposed to the virus. Most of the infections will be in young people and in unvaccinated folks. But eventually, I think we'll be having annual vaccines for COVID. The older people will get it. But, the deaths will continue to be in the elderly. So I also had a viewer say, what do you do when you work in an environment that takes the virus very seriously, but you go out in the world and no one cares? How do you enjoy a haircut when 5 feet from you is a maskless person you don't know what their vaccine status? And then sort of how do we get out of survival mode? And so this is really the concept of living with the virus. We're going to have to live with it. But first, a little data. So this is really fascinating. If you look at communities with low vaccination rates, there you have 6-fold the number of cases and 12-fold the number of deaths. So you're going to see a lot of variability in the United States based on your community. If your community is highly vaccinated, you're going to see very few infections and very little death. If your community is not highly vaccinated, you're going to see more of it. Now, I took the opportunity to look at deaths over the entire pandemic from COVID. And what you can see is it's clearly the older you are, the greater the chance of dying from the disease. But even so, if you look at it, there's 166,000 people, for example, who died between the ages of 65 and 74, but there are 33 million people in the United States who are in that age group. So that's actually 0.5% of the population, and most of these deaths were before the vaccines were available. If vaccination reduces the risk by 1/12, which is what the data shows, then your chance of dying from this disease in that age group is 0.04%. For 75 to 84-year-olds, it's a little higher, 0.08%, and 85-year-olds and higher, it's 0.16%. That's still pretty low. That's still very low. And so one of the things that's very clear to me is if you're vaccinated, and this begins Lily's 5-point plan, and she's done this because, my sister's been after her. She finally got around to it. But if you're vaccinated and boosted, you're going to live. There's a very good chance you're going to live. So one of the things that's really hard is to get into the mode that, I'm not going to die from this. There's a very good chance you're not going to die from this. And this is very similar to people who've had a heart attack. There's a real problem after people have had a heart attack of realizing that every time they do something, they're not going to die. And I think that's step one to living with the virus. You have to understand that you're not going to die from this. Now, if you get a breakthrough infection, you may either be asymptomatic or you might have a 2 to 3 day illness. But the chance of you dying from this, if you're fully vaccinated, is actually quite low. So that's step number one to living with the virus. You have to realize you're likely not going to die from this virus. The second thing is, where people are using checking vaccine status, like in restaurants or theater, go to those. You can go to those. If you know that the vaccine status of everyone, especially indoor eating, I wouldn't have any reluctance to go indoors in a place that they was checking vaccine status. Now, the theaters are pretty packed in New York, and I've got to, again, this is my sister. I would probably wear a mask, just because you don't know whether or not someone might be sick and you're all packed in. But you can start going to the theater. Travel, at point 3, travel. You can go to all kinds of places. Last week, a physician asked me where could he go to escape. I said, go to Italy. Most of Europe is safe to go. I wouldn't go to the United Kingdom right now because they really are not, in good shape. But if I travel to Italy, when I'm in public places, public transportation, for example, I probably wear a mask. But I would go. There's no reason not to go. And then the fourth point is I think we need to all become followers of the CDC. You need to know, are you in a community that's of low burden or high burden? And if it's under 10 cases per 100,000, you're in a good shape. If you're over 10 cases per 100,000, it's different. So let's first take living with this virus in a community that's of moderate risk, over 10 per 100,000. It's sort of like what we're doing now. I would mask in public places, but I'd enjoy the outdoors. Lily says, take a walk with a dog, and if you don't have a dog, get a dog. And if you have a cat, get rid of it. The other thing is, wear a mask indoors unless people are using vaccine passports. If they have vaccine passports, you're okay. avoid large crowds or wear a mask where you can't. So if you go to the football game, I personally would wear a mask if I'm surrounded by people I don't know their vaccine status. And the same advice I gave early on in this, if you see a store or a place that's pretending like there's no pandemic in the world, I probably wouldn't go in there. You want stores that are taking it seriously, and then I'd feel comfortable. What happens when we eventually get to less than 10 cases per 100,000? Then, there's no need to wear masks in public. Of course, you can still walk Lily or the dog you've just acquired. I think indoors, you don't need to be wearing masks anymore, and I think you should feel pretty comfortable that the odds are in your favor. Now, some people will feel more comfortable wearing masks. Go ahead and do it. But, to that viewer that said, what about that person sitting next to me? Well, if it's down below 10 per 100,000, the person sitting next to you, there's a 1 in 10,000 chance that they're infected. That's pretty good. So I'd start feeling pretty comfortable if they were asymptomatic. Now, if someone's coughing and sneezing, I don't like sitting next to them anyway. They may have the flu, they may have some other upper respiratory infection. So I think now we have to sort of monitor symptoms a little bit more than we did in the past. And then the last point of Lily's 5-point plan is I want to do a giant shout out to the folks in Santa Fe who were in a club that they basically said you can't be in the club unless you're vaccinated. And so your co-op or your condo board should start talking about this. Do you want everyone in the co-op vaccinated? If you do, why don't you put a sign up on the door that says we're fully vaccinated, all visitors must be vaccinated, and everybody as a service person must be vaccinated. You go a long way to putting sort of peer pressure on people to get vaccinated. You take it seriously in your organization, your place of living. Start being vocal about it. There's no reason why you shouldn't be vocal. So that is really Lily's 5-point plan for living with it. But first, step one is to realize you're going to live. I think that's the most important one. So this week I want to end with a couple of shout-outs. First of all, I want to do a giant shout-out to the Astros. They lost, but they lost. I also want to do another shout-out to my friends in New Mexico that hosted my visit there. They have a club with 100% vaccination status, and I give them a lot of credit. They took this step to do that, and I think that's a role model for other private clubs, private groups, places of residence. I also want to give a giant shout out to all the poets in the world like T.S. Eliot, who try to communicate very complicated messages to dummies like me. And then, of course, I want to do a shout out to our new member of the family. Lily's niece, Lucy, joined the family. Lily was not happy, and Lily wanted to have nothing to do with her. And so Lucy is living with her mother, not here in Houston. Anyway, that's all for this week. Can't wait to see you next week. Have a great weekend, and I look forward to seeing everybody next week.